I am Candice, and I'm with Utah Center for Evidence-Based Treatment. And then we have Emily, who's with the Children's Center of Utah, and we'll introduce ourselves a little bit in a moment. But our two centers have collaborated to do a 3-part webinar series for parents. So we will be talking today, but then there will be 2 more webinars over the next couple months, just with more information. So that's just some more information about us. And so the topic that we're focused on today is concern or common understanding early childhood behaviors and early signs of developmental disorders. So today is really focused on it being a question and answer sort of way to approach this, I guess. So hopefully everybody has some questions that they want to ask, but we also have received lots of different questions prior to today, and so we'll go through those as well. But so I'm Kandice Benallie. Like I said, I am with UCEBT. I'm a postdoctoral fellow. I completed my Ph.D. in school psychology at Utah State University, and then I completed my pre-doctoral internship at Johns Hopkins All Children's Hospital in Florida. Most of my training has been focused on early childhood, completing psychological evaluations for children, specifically for autism and neurodevelopmental disorders, as well as working with parents to manage disruptive and challenging behaviors, specifically through behavioral parent training.
I'm Emily. I am at the Children's Center, Utah. I am a pre-doctoral student. I completed my internship there as well. So what I specialize in, I do also have a school psychology background. I do a lot of early intervention work focusing on younger populations, specifically 0 to 6. The interventions and approaches that we use incorporate a lot of attachment-focused strategies. So we really hone in on caregiver-child relationships. And then with that, there are a lot of trauma treatments that I am trained in or receiving training in order to support intergenerational trauma issues and also ongoing trauma in young children and their caregivers. I also conduct psychological assessments right now, focusing more on autism evaluations. And finally, I do support the internship training program, sometimes participating in supervision or other testing clinics that the interns are involved in.
So just to start off, we just wanted to open it up to everybody to ask their questions in this area that we were focusing on. So this has a lot to do with early identification of developmental disorders like autism, ADHD, other developmental challenges, as well as maybe like how do we seek out these diagnoses or evaluations or treatments? What does the process look like? Anything like that. Let's go ahead and go through those questions. And then if anybody has any questions that come up throughout as we're going through these questions or as we go through some other slides, feel free to put them in the chat. So we got a few questions specifically about ADHD. So the first question was asking about the difference between an overly energetic child who does not nap and is always on the go versus ADHD. So this is definitely a hard one to answer because it definitely depends on the age of the child as well as other factors that are going on. I noticed that in this question, you specifically put a child that does not nap. And so definitely when kids aren't napping or getting good sleep, that could definitely impact their behavior. So the things that I would be looking for in this situation are, how is that energy impacting the child or their functioning or other things in the environment? So are they, for example, like if they're in preschool or even in kindergarten or elementary school, are they having challenges listening and following directions or staying seated when they're being told to stay seated? We would also want to differentiate between, are they having challenges controlling their energy, or is it more of like behavioral concerns related to maybe some like defiance or oppositionality where they're not listening more intentionally rather than it being something that they are just unable to control because of all that energy going on?
Mhm. Um, and then the next question, so signs of ADHD in a 4-year-old girl, what can I do if I see these signs? Are there books that you recommend a parent should read if they notice these? So when I see this question, the first thing that comes to mind is wondering in what settings this 4-year-old girl is having symptoms. So for an ADHD diagnosis, we understand that as occurring in 2 or more settings to meet the criteria. So that's the first thing I would ask myself, is this occurring at home and a group setting? Is there a group setting that we can consider? If not, I definitely think about taking this child to the pediatrician or seeking out some sort of parent support, which is in the second part of the question. At the end of the presentation, we do have links and recommendations for community services, and then articles as well, because there was a question about readings.
Yeah. And just to add on what Emily was saying, yeah, we have lots of resources, and I didn't think to put a list of books. I definitely have a good handful of books that I think would be really helpful in this situation. Um, and so I will put a list together and maybe I'll put it in the chat so that we can just keep moving forward. But I will come up with that list. This next question is a fun one. What age should crying and tantrums stop? How to recognize ADHD in toddler boys? Oh, crying and tantrums. So crying and tantrums can definitely be related to a lot of different things. So, for example, young kids and even up through adolescence, we know that their brain isn't fully developed. That frontal lobe, that prefrontal cortex is not fully developed yet, and that has a lot to do with emotion regulation. And so because these kids are still learning how to regulate emotions, crying and tantrums can definitely be common for a while. And it also depends on the personality of kids, as well as like parenting style and things like that. So it's hard to say like when crying and tantrums should or would stop. I think that it definitely evolves as kids get older and what they're about kind of evolves. And so I know that's not like a direct answer to that question, because it really depends, especially on the age and the circumstance. Um, and then just to answer the second part of the question, like how to recognize ADHD in toddler boys. Toddlers are also more challenging. It's not impossible to diagnose ADHD in young kids. Personally, I would probably feel a little bit more hesitant until they're at least like between 4 and 6. But some things that you might want to keep in mind are was there anything that happened in early childhood or even prenatally that could impact how their brain is developing? For example, if there was substances used while they're in utero, then that can cause more emotion regulation and some other like cognitive functioning challenges that look similar to ADHD. And so if I am aware of that, then like the idea of ADHD might come up for me a little sooner rather than like a child that hasn't had any history of that. I might be a little bit more weary about saying ADHD in really young kids because toddlers have a lot of energy and they're still figuring out how to focus and pay attention. And so those are all good things to keep an eye on um, as they're getting older. And if that high energy is causing challenges in preschool or kindergarten, and so on, or if they're still having troubles focusing in settings that we would expect them to be able to like sit and focus for a short period of time, then that's when we might start to consider ADHD. And Emily, feel free to add anything to what I'm saying.
Yeah, of course. I think that was a great explanation and definitely welcomes the thought that we are allowed to have concerns for ADHD in really young kids. It's not always just explained by young kid energy, which sometimes people don't realize with ADHD. I'm gonna group the next two together, low frustration tolerance and lying. The reason being that some of these behaviors are developmentally appropriate. It is appropriate to sometimes see children not telling the truth and then just having a temper tantrum over something that seemed easy to us as adults. And again, what we know about young children's developing brains is they are thinking very much with emotion. So it is hard sometimes to stop in those moments and use problem solving skills or coping strategies in order to break down a task and not get as frustrated or ask for help. But if we're thinking in terms of these being below or above what's developmentally appropriate, excuse me, let's stop and think about why these must be occurring as much as they are. Low frustration tolerance can be a symptom of many diagnoses, ADHD and autism included. It could be maybe a lack of access to coping strategies. Children with ADHD often do get really frustrated, just a shorter tolerance there. And then lying is pretty general. I wouldn't just attribute that to one diagnosis either. There could be relational issues between child and parent. And maybe that is modeled for them in some ways, whether at school by other peers or even adults. So that's a really, really broad issue that just can have many, many eggs in many baskets. It's really tough to pinpoint. And what can be done about it is also similar. So we think about coping strategies or positive reinforcement for telling the truth. There's a lot of things that could be done as well. I don't know, Candice, if you have anything to add about those broad things.
Oh, I would agree. I think these could definitely be developmentally appropriate. They could be associated with a bigger challenge. Yeah, very, very broad. I do think that these are things that might get addressed in the next webinar as well. So the next webinar is about essentially like giving you strategies and tools how to manage some difficult behaviors. And so low frustration tolerance and lying are definitely things that I would put in that category. And so getting some like skills and strategies on how to manage those can make a big difference. And similarly with these next couple of questions, so there's some questions about sibling rivalry, siblings saying mean things or helping children understand the importance of sibling relationships. These are some really good questions. I think that these are some things that can also be addressed in the next webinar with some specific strategies on how to help support those sibling relationships. And so in like the context of this webinar being focused on like early identification, like being aware of early signs, I think these questions are a little out of that scope, but I think we can definitely forward these questions to the folks doing the next webinar and they can definitely address those.
Definitely. And the final two questions go in that realm as well. They are bringing in some external issues out of the scope of this presentation, but again, as Kandice said, really do outline or align with future webinars. And then I want to add too that both of our centers, the Center for EBTs and TCCU, we do have consultation services for providers. And again, like we said at the end of the PowerPoint, there are a lot of resources for things like relational issues between parent and child for us to consider. I want to point out a question in the chat. So kids in sleep, at what point is sleep disturbance normal versus a sign of early autism or early ADHD? Yeah, that's a really big and important question. I It's a symptom of sometimes autism, ADHD for many reasons. It's not always just one explanation like many of these are. I think that for ADHD specifically, I think I deal with more sleep disturbances just because of changes in energy levels, winding down, difficulties following a routine, like a bedtime routine. And then when I say the word routine, I think about some individuals with autism and how it's very important in order to go to sleep at night to have that routine. But when the home is feeling stressful or we have multiple children, routines can be very hard. So sometimes a sleep disturbance can feel normal, but if we find that the child is sleepy during the day, or even not getting a nap because too much sleep at night, which I see sometimes, that's another type of, I guess, more atypical disturbance, and maybe could hint more towards something diagnostically. Kandice, I don't know if you have anything to add.
Yeah, no, I definitely agree with what you're saying. And sleep disturbance is associated with both autism and ADHD from early childhood up through adulthood, really. And so similarly with what Emily was saying, sleep disturbance can definitely be the result of like under and overstimulation throughout the day too. So both individuals with autism and ADHD do have some more sensitivities and can become more overly stimulated in certain way, or they seek out certain stimulation because of certain needs. And so those sorts of things can definitely impact sleep. And so something that's just often helpful with these kids is making sure that they have a variety of opportunities for stimulation throughout the day. And just like with what Emily was saying, if kids are getting too much sleep, that can also cause sleep challenges. I see it a lot with like really young kids who nap really well during the day and then not sleeping well at night. And so that's just a general thing, not specific to autism or ADHD, but there's just a lot of factors that go into sleep disturbance with these individuals. That is very common.
Mhm.
Oh, one more thing before we move on from the questions. Right before the presentation, we got one other question, so it didn't get put into the slide. And so it was a general question asking about early signs of developmental concerns. And so it's a great question and a really broad question. So there's a lot of pieces of development. So we have language, cognition, motor, lots of things. And so the first thing that I think of when I think of like early signs of developmental disorders or even developmental delay is, are kids meeting those milestones as we would expect when they're really young? So are they starting to say single words by 1 year old? Are they starting to say at least 2 to 3 word phrases by 2 years old? Are they walking? Walking is a tough one because I feel like it's usually like somewhere between like a year and 18 months. Like 18 months is like on the like later end, but it also isn't uncommon. And so just thinking about all that, a lot of times pediatricians have families fill out different milestone or developmental questions when they come in, especially with like the really young kids up through like 3, 4 years old. And so those are also a really good thing to like help you identify, like, is my child like having any developmental delays in any of these areas? And then if they are, talking to your pediatrician, talking to other professionals about what you can do to help support that. Because there's also a lot of like activities and things to help support development that I know when I didn't have a child, I didn't even realize that these things were anything. So,
Yeah. Candice, I'm glad that you remembered to bring that important question up. And this question also makes me think about the rating scale called Ages and Stages questionnaire, pretty much administered in pediatrician settings. Also, I hear some caregivers say like in Head Start, early childhood program settings. And at Children's Center, we give the Ages and Stages social emotional development questionnaire. So I think that the typical ASQ definitely hits on those motor developmental skills, speech and language. And then if we get into like social emotional skills being a separate developmental milestone, which is really broad, some of the questions being, does your child stay with you in public? Does your child respond to their name? Do they seek out interactions from other children? Those social and emotional milestones can also sometimes differ among children with developmental delays. So I think those two questionnaires tie it all together pretty nicely for those of us who have been exposed to that before.
yeah. And if you're not familiar with them, I would be surprised if you haven't seen them in a pediatrician's office. Yeah, I bet you just weren't aware of what you were filling out. Because I know the several different pediatricians that I've gone to, they've all done the ASQ. And thank you for bringing up the social piece, Emily, because that is really a key part of identifying autism as well as ADHD in young kids. I think the typical, like the general ASQ has like a little section on social, but the social emotional definitely gets at it a lot more.
Right.
Does anybody else have any questions thus far? Feel free to put them in the chat at any time. So Emily and I put together kind of like a rough outline of things that we thought would be helpful for families to know in this topic of, are these behaviors typical or are they concerning, and like what do we do next? So we've touched on this first part a bit. So this is really about just detecting early signs. So developmental concerns, like in those areas that we just talked about, cognition, social, motor, language, all of those things. And then we kind of we did touch on some like early signs of autism and ADHD, in general neurodevelopmental disorders. Some more specific things that might be helpful, like as we're looking for early signs of autism. It really depends on the age of the child because young kids are developing so quickly. So the expectations that we have tend to also rapidly change. But like generally with toddlers, we want to see that they are doing that parallel play with other young kids. They may not be engaging in that like collaborative play quite yet. There might be some early signs of that, but generally we want to see kids playing near each other and also showing interest in other kids. It might look a little awkward with toddlers at first because they haven't figured it out, but showing some sort of interest. Um, Also, some other early signs are how they're engaging with their caregivers. And so in like new and maybe uncomfortable situations, we want to see that kids are referencing their parents, like coming back to them, checking in, um, like showing things of interest to parents, being aware of like those nonverbal communication skills like eye contact, and other gestures. So with young kids, are they making the gestures with songs that they're singing in preschool? Are they like doing all of those sort of like nonverbals? Um, and then some of the other things that we also want to see kids doing. I lost my train of thought. Emily, do you have any other thoughts on like autism with early signs?
Yeah, yeah. So I was thinking a lot about pointing and how kids, lacking a lot of our typical verbalizations and requests, really. Um, something we ask parents all the time is, are they using pointing to ask for things and show things, just to bring you into their world? And with pointing, I think about Candice said gestures and eye contact and how we don't really think about this, but many of us do integrate those gestures together. And so we can just see that 3-point type of behavior. And then with showing someone something makes me think about, are they interested in others? Or Candice was speaking to play, are they more so playing by themselves? Is their play kind of more rigid, being the common term? And that can go beyond just not wanting to share. And then more specific behaviors associated with autism. I mean, that is a whole conversation. There are a lot of symptoms, but rigidity, struggling to transition being a sign. Sensory processing and development is huge within this topic. So are they demonstrating some really intense or under intense sensory related behaviors? And then we also see some repetitive behaviors that are sometimes a bit more individualized to help kids self-regulate. And that is such a brief overall synopsis of of the restricted repetitive behavior symptom category. And then we kind of hit on all the topics of the social communication category of symptoms there for autism.
Yeah. And I'm glad you brought up the sensory processing piece because oftentimes with individuals with autism and ADHD, there's a lot of overlap. And so, like, sensory processing and how they react to different stimuli can look similarly. And so, when we're trying to differentiate between these things, it's hard to say, like, this is autism and this is ADHD because there can be a lot of overlap even with like the rigidity and like need for following a specific routine, that can also be common with ADHD as well.
Okay. Um, for evaluation side of things, so we did mention the pediatrician a few times. And then at the end of the presentation, we have more information about the two organizations that we represent. So I'm speaking more toward, thorough autism evaluations. And really, really an important part of this subject is knowing that schools versus outpatient settings have different limitations. Schools can't provide formal diagnoses for these developmental concerns, for autism, for ADHD. So looking outside of the school setting and bringing that to the school setting from that clinic, from that examiner, in order to give that child the supports they need in their school setting, if any. Not all children with these diagnoses need supports in schools, but sometimes it can feel confusing because schools do evaluations and they do support accommodations under eligibility criteria called autism spectrum disorder, depending on your state. So that can feel very challenging when we're on this path of evaluation for sure.
Yeah. And along those same lines, like understanding the purpose of each type of evaluation, the school versus the outpatient. So Emily mentioned that in like an outpatient setting at either of our centers or other places, we are providing a diagnosis, like a medical diagnosis. And the purpose for that is to open up doors for treatment. For example, a lot of ABA centers or applied behavior analysis places require a diagnosis of autism to be able to access those services. And although schools can identify children and classify them for special education under that autism classification, unfortunately, that cannot count as a medical diagnosis that opens up those services. So through the school system, their purpose is really to provide school-based services under an individualized education plan or even like a 504 plan. So providing lots of supports and services. However, it doesn't open up doors for other treatment options outside of the school system. So both are very important and have different purposes.
Mm-hmm. Yep. Yeah, Candice is reminding that the diagnoses are a gatekeeper. Medical diagnoses are a gatekeeper. Correction there.
Yeah.
All right. So, tips and practical strategies. Before I go into that, we do have a question in the chat. For a 3-year-old girl with ADHD that is receiving early treatment and care from the Children's Center in Utah, how is she likely to develop over the next few years? What are some milestones of success? Oh, that's such a good question. So I'm kind of stepping back a little bit and thinking of this individualized child, and wondering what exact symptoms of ADHD she might have, because not every ADHD shoe fits every foot the same. And then so that comes to mind first, and then how she will develop over the next few years. That also is kind of making me wonder about more of those individualized characteristics. Although this is not a consultation webinar, we can talk out some of these things broadly. If this child is, say, in the preschool program at Children's Center, she might be developing social skills in a smaller setting, learning regulation skills, coping skills. So ideally, that would support her over the next few years as she goes into a K through 12 setting. And then milestones of success. I mean, I don't know about Candice, but when I see a milestone of success or think about what that is, I think about, for an ADHD child, I think about just having those tools of self-regulation and using them and knowing when to use them and having that bodily awareness of when we're feeling big feelings. I think that that is huge. And it sounds like it would be really helpful for this little girl. And then I'm assuming this child is receiving family therapy at Children's Center. I mean, because of that, just how involved a caregiver might be in that treatment, because it is heavily caregiver involved. I would expect, given that support, a close relationship with a caregiver who can teach this girl those skills that I'm speaking to. Candice, I don't know if you have anything to add. This is such a good question, and I want to make sure it's being addressed.
I think one thing that came to mind when I was thinking of milestones for success. Now, it's not necessarily a specific milestone per se, but if we're thinking about like measuring like progress of anybody really, like how are they like functioning? Has their functioning changed in any way? Like, are they doing better engaging with other kids or siblings or parents? As well as like, how are they doing in like a group setting, like preschool or school? How is your distress? Like, is that improving? Like, are you feeling less stressed? Do you feel like you have the tools to help support your child? And so those are kind of things that came to mind when I was thinking about like measuring success.
Yeah, that's such a good point. Just what are our objective, our tools? How do we track these data? And I'm thinking of what the Children's Center does for that. And I know that that's a huge part of the work there. And you know, across most early childhood centers, mental health in general, hopefully. So yeah, I'm glad that you mentioned that, Candice. Um, so I'm recognizing it's 6:37. So I do think that we should cover just preparing for a diagnosis quickly. I do think that these other areas were at least touched on a little bit. And then we did hit on some of the diagnostic process. You know, what does it involve? It usually involves some sort of adaptive measure of a child's functioning. So what's their independence? And Candice already said the main areas there, social, motor, and then also some practical abilities as well. So there's usually some sort of reading scale there. And then in some, but not all, there would be an intelligence test to rule out any cognitive delays or differences, to make sure that's not better explaining what is going on, what we're seeing. And then finally, most medical centers do aim to provide the ADOS, which is the Autism Diagnostic Observation System, to give a formal autism diagnosis. That's very important to include in the assessment.
And between like ADHD and autism, those evaluations can definitely look different. Or if we're looking at both of them, then it can look different. But just like what Emily said, like there's usually rating forms specific to autism and ADHD or other developmental concerns that we have parents fill out. If a child is in school or in another setting, then we try to have that setting fill out some rating forms, especially with ADHD, because we need to see that those behaviors are in multiple settings. And yeah, just like with what Emily said, she hit it with all the main things.
Yeah. All right.
Um,
Okay.
So with some like community resources, so with young kids, especially under the age of 5, early intervention is particularly helpful, especially when there are developmental concerns. And this isn't just like autism and ADHD. This is also if you have a 2-year-old who is not speaking yet, that early intervention is really helpful for that. Or if there's motor delays, early intervention really touches at a lot of different areas of development. And so in Utah, we have Baby Watch, which is for under the age of 3. And that is a system in place that there's a lot of different providers who oftentimes come to your home and offer these different supports in areas that your child needs. So social, motor, if there's sensory concerns, lots of different areas that early intervention impacts or offers support. And then as a child gets older, so between 3 and 5-ish, like when they're starting kindergarten, it's usually like a special education preschool option through your school. And so that like a school-based evaluation would help them access those services.
Mhm. Absolutely. And then the parent role within all of that, I mean, it takes the caregiver to initiate these things, right? So it takes that caregiver noticing these signs, asking for help, knowing who to ask for help, knowing how to generalize these strategies at home. And that brings in the responsibility of the provider or the person conducting the early intervention, so that these, whatever these behavior, social, emotional, speech, and language interventions consist of, also occupational therapy, so sensory concerns as well. We do really want that translation, that bi-directional school and home intervention system. So depending on the level of need in the child would increase what the parent is doing at home to help. And that brings me to, this last bullet here about resources, support groups, organizations. We do have many of those. And then I know that we also wanted to wrap our own organizations into this topic as well.
Yeah. And before I say this, one thing that I don't know that we mentioned with the diagnostic process, we were talking about going to your pediatrician if you have concerns. And the people that often provide diagnoses for autism and ADHD, learning concerns, those sorts of things are psychologists. So sometimes that can get a little confusing about where you go to get those evaluations. So psychologists are typically the ones that provide those diagnoses. Okay, so I am at UCEBT, so these are some different services that we offer. So we offer behavioral parent training, or also known as parent coaching. And this is especially for situations where there's like challenging and disruptive behaviors that you're wanting parent support with managing those at home. And so we offer individual therapy for that. And then I'm also starting a group at the beginning of March for parents as well. And so if you're interested in getting access to parent coaching in a group setting, please let me know. We also offer psychological services for 2 years and older, autism, ADHD, learning disability, any like cognitive challenges. We offer that. And then we also provide a lot of evidence-based treatment for child mental health. So if there's concerns for social skills, disruptive, challenging behaviors, emotion regulation, anxiety, OCD, we have a lot of providers that offer those services, as well as webinars like these and other presentations.
Okay, so for time's sake, I'm going to fly through this and really encourage that you all visit the website. Just to add some things, I mean, our organizations overlap a lot in what they do in terms of, disseminating information to the community. We also have psychiatry services. We have our outpatient group program, the therapeutic preschool. And then we are also conducting evaluations as well. Our trauma treatments really focus on, again, early childhood, parent-child relationships. And then we have some other groups that are conducted to support parents, including Circle of Security and Infant Massage. But please check our website for more. And then here are some resources as promised many times. There are so many here, and they're structured based on the topic that you're needing support in. And then this is just screenshots of the Children's Center's website to just show you what kind of articles and readings that you can have access to if you follow that link. Okay. I know that we are at the 6:45 mark, but if there are any questions currently, let us know. You guys have done such a great job of sending some in the chat, so we appreciate that.
And then I also said that I would send some books. So I will get that together when the slides are sent to everybody and the recording is sent, then those books can also be sent. But thank you all for joining and chatting with us and letting us provide just some more information. And hopefully that was helpful.
Thanks, everyone.